Welcome to a very special web chat on a very important topic, the state of our health, and what could be more important than that. If you're tuning in now, it's because hopefully you just watched this special report, the state of our health, and we really want to thank you for joining us. We know the stats. Michigan isn't doing well when it comes to health. As you heard, we're not in the top 10 or the top 20 or the top 30. Michigan ranks 34th when it comes to our health, and we all know we need to do better. So in this show, you heard the issues, you heard the concerns, and we learned about this grassroots movement, this effort to inspire change and get all of us healthier. We're here tonight with experts to speak to you and to answer your questions and to hear your concerns as well. So we hope that you'll call in via email, phone, on Twitter, hashtag SJJoinMe. The number to call in, 248-356-0077. I'm Lila Lazarus. With me, the CEO of St. Mary Mercy in Livonia, Dave Spivey, and someone who doesn't just talk the talk, but also walks the walk. In fact, on Sunday, I watched him run the run, the Embrace Life 5K. So he's not just talking about being healthy, he's inspiring others to do their part while he leads St. Mary Mercy. And also with us, the doctor is in, and when I say the doctor is in, he is in touch, he is inspiring, and he understands what it means to be healthy, body, mind, and spirit. Dr. Stephen Theory, he's an IHA family medicine physician who really sees the distressing results of what's happening in our culture every single day in his office, and he's working to inspire change with his patients and everyone around him. So thank you both for being with us.
Happy to be here.
Thank you.
They're going to answer your questions about a healthy workforce, about healthy communities on a daily basis. And now it's time to take your questions as well. Again, the number to call, 248-356-0077. You can follow the discussion on WXYZ.com, and of course at hashtag SJJoinMe. So I'm going to start with you, Dave Spivey, the CEO of St. Mary's.
Yes.
And I really want to understand, it's such a big hospital in this area, how important is health and wellness, not only of your employees, which is important, but for the whole community. What role does the hospital play when it comes to health? We think of the hospital as the place we go to when we're sick.
Right. Well, that's the traditional role of hospitals and physicians in our community, is to respond to people when they're sick. But increasingly, with population health and the efforts to really become a more integral part of the community and fulfill our mission as a healthcare provider, we're focusing more on wellness. Within our organization, we're focusing in on closer to home with our own employees. We have a health and wellness center. We're introducing programming that is health and wellness related. Weight Watchers, smoking cessation, yoga, Tai Chi, massage, a variety of things to really induce more healthy behaviors on the part of our staff and then reach out into the community.
But why is it important for a hospital, or in this case, St. Joe's Health System, for an entire health system to inspire change?
I think it's about walking the talk at the end of the day. We're health professionals. We've got to lead by example, and if we do that, it's going to be inspiring to those we come into contact with.
And Lila, I'd say also reduce suffering. I mean, we see the end result of people's choices and behavior. It ends up as suffering. And so to inspire change earlier, we can help people avoid suffering.
So working as a doctor these days, and we heard what you said in the special report, that there just aren't enough doctors for the number of patients you're seeing.
Yeah.
But since you're on the front line, and you see this every single day, tell us how bad it is and what it is that you're really seeing on a daily basis that all of us need to work on changing.
Well, I'm not sure I would characterize it as how bad it is, but I do see the struggles, and I see frustration, I see motivation, but I see a lot of frustration of people of not being supported to be able to make the changes they need to make. And that's why I think the Join Me campaign is important, because I see the need for the whole community to get involved in health and wellness. So we're happy to be leaders of that movement, but this is outside the campus and into the community for people's lives, day to day, moment to moment, meal to meal. Yeah.
I don't want to start this by arguing with you, but I'm going to argue with you for just a moment.
Yeah.
You said you don't want to talk about how bad this is. 25 years ago, and that's not that long ago,
Yeah.
we had obesity in Michigan of 11%.
Yeah.
Now we're upwards, north of, I think, 32%.
Yeah.
That's pretty bad. And then when you talk about the associated diabetes, cardiovascular disease, et cetera, you know it better than I do.
Sure. There's a great burden of disease and chronic illness. So yeah, on a daily basis, I see people on a lot of medicine who are generally overweight, who may not be getting enough sleep, who feel a lot of stress, and the trajectory is not good. You know, the trajectory is for problems down the road. So I definitely see that every day. And there's definitely a call to action there because it's overwhelming us as a healthcare system. It overwhelms our ability to deliver the care to that many people. We don't want to wait for them to have a heart attack. We don't want to wait for congestive heart failure. We don't want to wait for diabetics to have, bad sores on their legs, not healing sores, right? We want to get there before that. So that's where we really need to work together.
All right. We want to take your calls, your questions, your concerns. The number to call, 248-356-0077. Right now we have Linda on the line. Linda, you have the CEO of St. Mary's and also Dr. Stephen Theory with us. Tell me, what's your question?
My question is that there's a lot of studies to show that GMOs and other chemicals can cause autoimmune and inflammatory diseases, and which helps increase weight in our bodies and increases sickness and disease. And so I wonder why we're not looking at that as another way to help people be healthier, go organic. I mean, we do go local in farmers markets and things like Eastern Market. It's awesome. But what about the GMO issue?
So before you guys start, Linda, can I ask you a few questions about this? First of all,
Absolutely.
When you're grocery shopping, are you going out of your way to make sure you're buying those foods that don't include those?
Absolutely. We don't eat anything if it's not organic. Obviously you can't do it 100%, but we do pretty much, I'd say 90% of what we eat and drink is non-GMO and or organic.
Dr. Theory, I'd love to hear you respond to Linda.
Well, bottom line for me, Linda, is that most people don't eat enough plants, period. And that's the pressing problem. And you bring up a very good point. And I know there's controversy about the science behind GMO or non-GMO. I think a bigger issue is probably antibiotics in the food supply. I mean, I think that really is
that's huge too.
Yeah, that's a very pressing issue. So luckily, we're at a time now where choice is possible. Like, there is so much better choice and selection. So let's celebrate that. In terms of a healthcare system addressing GMO, that's probably beyond the scope of a particular healthcare system.
So I just thought, when my mom was in the hospital, they fed her horrible food. It wasn't your hospital, just so you know. And there was no way that could improve her healing capability at all.
I'm so glad you mentioned that, and I know my dad is a diabetic. When he was in the hospital, and I would watch them bring him sugar Jell-O and that kind of thing. Again, not at St. Joe. But I want to ask you, because I know, Dave, sorry, you've been talking about what you guys have done in the kitchen at St. Mary Mercy in Livonia.
Well, we've been trying to improve the food preparation and product that we serve, both to our staff and our visitors as well as our patients. We're not quite there yet, but we're working and incrementally getting better every day, balancing the desires and tastes of our clients versus a healthier offering. And so we're making progress. We're actually a part of a group of hospitals that have been part of the Michigan Health Association that are banding together to do something about the quality of the food that we provide, and trying to get away from the manufactured food and be able to serve fresher food, locally grown, Michigan-grown food.
Which is so commendable. Plus, they're at St. Joseph Mercy Ann Arbor. They actually have the farm, right? Right there on campus. Can you tell us what the farm is?
The farm is a project, 5 years now, hoop houses and fields, and we have grow produce for a farmer's market in the hospital. We also have a rehab hoop house that was designed specially for people with traumatic brain injury, and we're finding that getting people gardening is powerful therapy.
Wow. And actually, patients are sometimes eating the food that was grown on the farm.
We bring food into the hospital. It's a challenge to supply enough food for a hospital system, and there are a lot of issues with infrastructure and preparation, but there's a willingness and an openness for us to provide.
In the old days, to your point, Linda, food was so unhealthy inside a hospital that I thought it was job security for the doctors. But as you heard in the show, Rob Castley, one of the first things he did when he became CEO of St. Joseph Mercy Health System was pull the fryers out of the hospital. So you've
Right.
seen, you've been there how many years?
25.
What have you seen in terms of healthier food inside the hospital?
It's dramatic. It's dramatically different. I mean, getting rid of the fryers, the selection is bright and colorful and fresh, a lot more plant product. And then there's just more awareness about the role of saturated fats. So, you know, low-fat dairy products, leaner meats. It's inviting. It just feels very friendly.
Right. It's so hard, though, in a fast food nation like we have. I mean, forget organic, forget non-GMO. How do we just, as you mentioned, get people to eat fruits, vegetables, seeds, and nuts?
Yeah.
I mean, that's a really tough thing. People
You know,
want...
though,
Go ahead.
Can I say one thing?
Sure.
A lot of people that I know want to eat better. They don't have the education or knowledge to know how to eat better. And I think that's lacking in our society, a place where they can learn that information because they're so, removed from the food source at this point in life. They just don't know how to get good food or what good food is.
Can I comment on that?
Yes, absolutely.
So Linda, you'd be interested to know we have a project at the farm that Lila mentioned where we're bringing all the third graders and fifth graders from Ypsilanti to the farm. And it's remarkable to see kids when they see carrots growing in the ground and they see where food comes from, because you're absolutely right, a lot of kids don't know. They don't know, and it's very exciting.
So if we were to arrange to have a navigator there in the grocery store, showing you the healthier choices, teaching you how to read labels, showing you the difference between the organic, the non-organic, would you use a navigator like that, Linda?
I don't need one, but I do that for people when I go to stores that have an organic or health food aisle, and I help them find the things that they're looking for, because they go, I don't know what gluten-free soy sauce looks like. I go, it's tamari sauce, and it's over here. So,
well, you heard in the show, the diabetics are saying, hey, where do I go? What do I eat? I don't even know.
Right.
Yeah.
So it's a real problem. We have an email here I want to share with you, and maybe you can give an answer, Doctor. How can you eat healthy choices if you're on low income and a very tight food budget?
Yeah, that's a big challenge, and we're lucky in that the cost of food is at an all-time low in America. We're a little bit unlucky in that a lot of the agricultural industry has been subsidized so that we produce a lot of really cheap corn and high fructose corn syrup, and the food industry's figured out ways to make foods almost addictively tasty with sugar, fat, and salt. And they're so good at making it cheaply. Part of it is people may have to actually budget a little more money for food. Another part of it is there are some simple things that taste really good, but they may not be common for you to eat, such as rice and beans. That may not sound exciting, but a lot of the planet has subsisted on food like that for a long, long time, and they've been really happy. In fact, fresh food just tastes good. I mean, fresh salsa is wonderful. So I think sometimes it's learning about simple recipes using simple ingredients, and then the bad news is you probably have to cook a little more. It can't be sort of the fast, quick, the drive up lane. That's just got to go for a lot of people to improve their health.
I always find that the more ingredients there, the less likely it is to fill you up. When it just says rice, lentils, avocado, that's what you want to hear.
Yeah. Yeah.
Instead of so many different things that you can't even pronounce.
Mm.
All of this is to inspire you. That's what this show is all about. It's all about this Join Me effort, a grassroots effort aimed at opening up the conversation and really inspiring change, hearing from the community what the needs are, what the concerns are, creating programs and access based on those conversations. Now, I'm fortunate because not only am I talking to the CEO of a hospital, but I'm also talking to a doctor who both are people who truly believe in what they're saying. They're both yogis. Talk a little bit about, especially you, Dave Spivey, what being healthier, because you've gone in a different direction before.
Oh, absolutely, and
Can you be really honest
Sure.
about?
7-8 years ago, I was going in the wrong direction, gaining weight and having mild hypertension, and staying away from the doctor because I didn't want to go and have him tell me I wasn't doing the things I needed to do. And so probably not unlike a lot of people listening to this show tonight. But I went to my primary care physician, and he told me a couple things. One is you're probably going to live a long time. But the quality of your life 20 years from now is going to depend on how you take care of yourself now, so you need to get started.
Good news, bad news.
Yeah.
You're going to live a long time.
And so, he typed me on a health plan. He said, you need to exercise an hour a day. You need to eat more fruits and vegetables. You need to stop smoking cigars, which I've done, And I went home, I put that on my refrigerator. I didn't do anything. But I went back the next year and I took it with me. And all the numbers were the same. I weighed the same, still had mild hypertension. And he went into his spiel again about you're going to live a long time, but the quality of your life is about how you take care of yourself. So I pulled out my health plan and I said, remember you typed this up for me last year? And he read it and he looked at it and he looked up at me and said, it's still good. And I said, well, that's the challenge I need to respond to this. And I started living a little bit more healthier. I started exercising regularly, eating better, lost some weight. My hypertension got under control,
Awesome.
and I feel a heck of a lot better. And there's ups and downs, but you just keep at it. Find out what's fun for you. Yoga is fun. It's relaxing. It's spiritual. Jogging, it gives you, it gets the endorphins going, makes you feel better.
Yeah.
Whatever it is for you, I think the governor in the show talked about just getting out there and moving around. That's the start. Going for a walk, and from there, the sky can be the limit.
You don't have to run a marathon. You just have to move. Something tells me we should have been on like treadmills or something as we're having this conversation. Would have been a little more comfortable. But I will say this. It's so important to not only move, but also you mentioned that mind-body connection. Can you talk a little bit about that?
Oh, well, and the word yoga means union, and the idea was mind and body actually being united. And I think sometimes it's about waking up to how you really feel, sort of relearning how to pay attention and notice, because we're so busy, we're running through our lives, we're on the go. You don't have a lot of time to pay attention to really just how you feel. I see a lot of patients, or even my staff, at the end of the day, neck hurts, shoulders are sore. How'd that happen? They were sitting on the phone all day or talking. You build up that kind of tension in your body, and you almost have to bring a focus to see it, to notice it, and then you realize, I'm doing this to myself. And then the opportunity to do different. I mean, yoga's a prime example, but there are lots. There are lots of ways. Just sitting better in your chair at work, Pilates.
We're both sitting up now.
Breathing, breathing a very powerful tool. So, and I would just say that making change is difficult, but if you can come from a calm place, I mean, Dave used the word spiritual, but that relaxed place, it's a little bit easier. There's just a little bit less noise and chatter in your head, and you just notice what feels good. I love that Dave said he felt good. It's very easy to keep doing things that feel good.
It's a good moment to take a really deep breath right now and make the exhale a little longer than the inhale. So you're giving out a little more than you're taking in. One of the things you mentioned was this concept of living longer. And the truth is, despite all of these bad statistics that we've spoken out, people are living longer, but they're living longer sicker. Mm-hmm. And what we want to do, from preventable diseases, right. So what we want to do is figure out a way to truly prevent those diseases much earlier. Should we be doing something in the schools? And should Join Me be more connected to the schools? Or is it the responsibility of the families or the doctors?
I think absolutely. I think that Join Me campaign will partner with the schools and the rec centers in our communities, the healthcare and the other healthcare providers in the community. The schools, we need to get back to having gym and recess every day, and making physical activity a big part of the day in addition to learning. I think if we did, we'd probably have a little bit better, less attention deficit disorder, if you will, and kids better able to pay attention in school.
Explain to me a little bit about, in the middle part of this show, we talked about this concept of population health. Can you make that simple for all of us, what population health really means, and why hospitals are now so focused on population health?
Well, it means a number of things, but overall it really speaks to the overall health of the community and what is the healthcare system doing in partnership with those in the community to take greater accountability for one's own health, to live a healthier life and reduce the threat of chronic illnesses, to to really turn the tide that we've witnessed over the course of the past 30 to 40 years, a deterioration of health. And if we're not successful with the overall health of the community in which we reside, we're arguably not successful as a healthcare system. We're not successful as a healthcare system.
The other question I have is about sustainability. So let's say you get a patient to understand they're going in the wrong direction, and after 50 years of not exercising, you really need to start. After 50 years of not eating right, you really might want to change the way you eat. And they go home, they go grocery shopping, they maybe even take a walk after dinner.
Yeah.
How do you sustain that next week, next month, next year?
Well, I don't sustain it. The person has to sustain it. As Dave said, there will be ups and downs. But I like, again, Dave said he felt better. And I think when people get out and move a little bit, they feel better physically. They see their neighbors. They notice things in their neighborhood. They feel more connected to their community. And they feel good. And when you eat better and you start paying a little bit of attention, maybe more to how you feel after you eat, not like, I can't believe I ate the whole thing, but, you know, to be able to get up and walk, not like you got to go collapse on the couch, like, oh man, if you feel that way after you ate, you didn't really eat well for yourself. And you deserve to feel better. It's your right to feel better. And so I keep the focus on feeling well. Just notice. And I think you'll enjoy doing it. There's always obstacles. There's stuff in the way. Your energy's a little low. One of my tricks, Lila, is low energy. As you said, take some big, deep breaths in and out, and it's amazing. You feel better in 5 seconds. Or drink 8 ounces of water. It's amazing. You feel better. Or
when you're in traffic, take a breath.
Yeah.
Instead of screaming at I like it when somebody's driving to yoga, but they're screaming at that person next to them.
Can you believe it? They're going the speed limit. You're in a hurry.
So for the last 6 months, we've been covering, as St. Joe held these lunch and learns all over Metro Detroit, in Chelsea, all over, everywhere. And they were trying to get people to join in on this conversation, these join me lunches. What do you guys think of this effort, this campaign, this concept of join me?
Well, it's the right concept. It's the right campaign, going out and listening to the community and the members of our community, stepping back and looking at the forest for the trees. You know, those are our clients. We're here to serve them, and where better can we hear how to do that more effectively than talking with them? It's the right thing to do, and it's really provided value to us and given us some new ideas on some things, but also, you know, validating some of the problems that we thought were there, access to care, transportation issues, financial burdens, access to good food, as one of the callers spoke about. We have a bit of a food distribution problem in a lot of our communities. Produce a lot of food, but we don't have a good place to go shop for it in too many of our communities.
And even when we go out to some big sporting events, traditionally it has been very difficult to find something healthy to eat when you go to a ball game.
That's right, but we're working with the Lions and the Red Wings to bring healthier choices to the stadiums, and you know, it's going to be one stand at a time, you know, 2 stands at a time. But I think, you know, there's an option to the double bacon burger, you know, at football games.
But how do you change those traditions? I know my husband goes to a baseball game; he's got to have the hot dog.
Have the hot dog.
Really?
But make it a treat. That's special. Yeah. You don't have the hot dog any other time.
Everything in moderation.
Right.
Yeah.
That's the key.
Don't deny yourself, too, because that just gets you into bigger trouble.
So you've seen the show. Tell us what you think were the most important parts, your favorite moment in the show, the thing that you hope stays with the audience. And again, we're taking your calls, your concerns, your questions, 248-356-0077. We do want to hear from you.
Well, Lila, I told you earlier that I thought the Roll Detroit or whatever.
Slow roll.
That is so wonderful and so powerful. And I can tell you, sitting in my chair, I wanted to be on a bike in that crowd. I mean, just participating. I think it's joyful to be with people and to be celebrating life, right? I mean, that's moving your body, celebrating life. I just love that.
There's so many great things about that slow roll. Right. First of all, that it started in Detroit and it's now spreading to cities, not just across the country, but across the world. But also that you have 5,000 of your closest friends of all levels, backgrounds, physical capabilities, and they're all there just to move, just to experience something and to connect We talked about how important that connection is. None of us can do this alone. And it's so much, that's why we have health clubs, because people enjoy doing this together. And so to have the Slow Road, which by the way is every Monday night in the summertime, it's so fabulous. It's just such a great way to get moving, and I really enjoyed that. So
well, you look good on a bicycle.
Thanks. So your favorite part?
I think looking at our leaders, whether it be Rob as the leader of our healthcare system and our governor, their focus on health, and they have a game plan. We have a game plan. The governor's 5-point plan of trying to reduce hypertension, getting out there and exercising. Go into your primary care physician and getting the history and physical. It's not rocket science, and we just need to begin to start joining together and getting up there and moving.
How important is that connection to the primary care physician? Because we keep saying we don't want hospitals to just be about sick care. We want to help promote health to begin with. And what is that primary care physician's spot? Because traditionally we've only thought about the doctor when we're sick.
Yeah. One concern I think that Governor Snyder addresses is there are a lot of people walking around with conditions and don't know they have them.
What is it, some 9 million people walking around with diabetes who don't even know they have it?
Right, and hypertension would be the other. Those would be the two big ones. Very important to get that figured out because it's often very motivating. I mean, it's that kind of thing that turns somebody on like, wow, I remember what happened to my uncle or my aunt and I don't want to go there. So that's very powerful. And then I hope we look to physicians to be guides and coaches. We want to be helpful. We want to try to help people sort through what matters most to you and how am I going to help you get it, and what are the resources in the community that I can connect you with.
You both have children. You both have grandchildren. They're growing up in this world with all of the statistics, and we talked, you don't want to call it bad, but we talked about what's happening in terms of people's health, and we've been going down the wrong road for a long time. Hopefully this will inspire change. Maybe it's a slow movement like the wave at a baseball game. We'd love for that to happen and for it to continue round and round and round. But you have children and grandchildren. What do you hope happens and what needs to happen for them to grow up healthier than you and I?
I think getting started with physical activity early, get within a community, whether that's a soccer team or a yoga class or whatever it may be, or a dance club, getting active early. It was easier. Steve and I were talking about this, for us 30, 40 years ago, we'd run outside after breakfast and stay out all day in the neighborhood. And those days are behind us. So it's fundamentally important that we get kids active through other means and get out there and exercising, with their peers.
Yeah. Perfect. And I'm not worried about my kids. They're turned on and move and eat well. But when we talk about all of the kids, and we're all sort of taking care of each other in this world, activity is huge, and food, and just being able to introduce kids to healthy, recently alive, fresh, colorful food. I love the billboards around the state now. Model it to your kids. The kids see you be active, they'll be active. You bring home this good food, your kids are going to pick up on it. And don't fight over it, just be relaxed about it. I would say that's the wave of the future. Take them to a farmer's market. What a wonderful, turned-on experience that is, to walk down the aisles of a farmer's market. It's just a delightful experience, that I think kids would really enjoy.
And for other businesses, for other organizations, maybe even for other health systems, could you guys give your parting comments and thoughts?
Well, I think, I would ask them to join us in this effort. Join us directly, through connecting to resources we have available through our health system, but join us, indirectly in promoting the same types of principles within their own communities. A healthier workforce is going to make for a healthier company. A healthier community is going to make for, a better community within which to raise a family and to live. So join us would be my message.
Dr. Theory?
Ditto, and maybe look within. How can you be a healthier employer? What's it like to work in your system? How healthy is the food in your system? So let it start at home. I think it'll be like the ripples in a pond.
Let's hope so. Take control of your health. Make a connection with your doctor. We are all in this together. You can visit stjoeshealth.org/joinme, learn more about Join Me, and to learn about health and wellness events near you. Again, hashtag SJJoinMe. We are so glad that you tuned in, so glad that you watched our special report. I love to say it, join me. So for Dave Spivey, the CEO of St. Mary Mercy in Livonia, and also for Dr. Stephen Thierry, I'm Lila Lazarus. Thanks for tuning in.